She's a fashion blogger, model, and entrepreneur.
She's amazing.
The latest tips on fashion, beauty, wellness, travel, and her lifestyle. And now, here's the founder and creator of Not Basic Blonde, Olasha.
Hello, Dr. Judith, and so glad to have you on my podcast. How are you today?
I'm great. Thank you for having me. I'm so happy to be here.
I'm sorry, let me redo this because I misspelled your name.
No,
Judith.
it's okay.
Judith, right?
Yes. Yes, Judith.
Hello, Dr. Judith. I'm so glad to have you on my podcast. How are you today?
I'm great. Thank you for having me today.
Yeah, it's my pleasure. And you being such an incredible doctor, having so much success, we would love to know more about you and your career.
Thank you. Thank you for the kind words. I'm a psychiatrist, so I do medication and therapy. And I also have a lab. So I have a clinical lab where I research things like ADHD, depression, dementia, anxiety, schizophrenia. But I also have a separate lab where I do happiness research. It's called the Happiness Lab. And the reason I have the second lab is because, like you said, I was an accomplished doctor doing all the things, but I was feeling like a lack of joy in my life. And I thought maybe in mental health, we don't focus enough on joy. And it's because maybe the healers are unhealed. And I was going through a period where I wasn't really feeling a lot of joy. And there's a term called anhedonia, which is basically means a lack of joy. So like you're eating your food and you're not really enjoying it. You're with your friends. You just kind of want to go home and watch TV. Um, you know, you're listening to music. You don't want to dance anymore. So really not getting a sense of joy in life. And that was me. And yet on the outside, I was productive. I was functioning, pathologically productive, doing a gazillion things. And everyone thought I had it all figured out. But I didn't even realize that I was actually struggling inside. So I wanted to dedicate, a part of my research in my lab to understanding something called high functioning depression, where people have a mask of productivity, but really inside they're struggling. And also dedicate my work to bringing joy in life, cultivating joy.
That's incredible. Definitely, we don't spend enough time and we don't think, especially when we talk about mental health, we don't talk about joy. I'm glad you mentioned this. And is your specialty being high functioning depression? How is it different from regular depression and the symptoms?
That's a great question. With classic, clinical depression, people have these symptoms of depression. Like, so they may not be able to sleep well, they may be tired, they may be moody, they may have poor concentration, guilt, hopelessness, sadness, at times anhedonia, but they're still functioning. They stop functioning, I'm sorry, when they have clinical depression. They break down, so they're not able to do the things that they used to do. Whereas people with high functioning depression, they have these symptoms, but rather than breaking down, they overfunction, like they're that single mom who makes sure her kids get to school on time, to make sure she's providing, but she's not really feeling joy. She's just going through the motions. And if you think about the entrepreneur who doesn't really take a break, who doesn't want to slow down, who's afraid of losing everything, they may have symptoms of depression, but they don't want to slow down and they're struggling. Or if you think about the immigrant, who comes to this country and, he or she left people behind and they are struggling, but they don't want to seem ungrateful. So they just push through and they overwork and they save and they never save her life. There are a lot of us that walk around like this. Think about the teacher, who shows up for her students, but doesn't even eat lunch and, really doesn't live life to the fullest. A lot of people are pathologically productive and they experience depression, but they don't process it. They don't acknowledge it. They just push through it. And I want people to realize that you can have joy in life. It doesn't have to be a grand thing, but there are things that you can tap into to experience more joy every day in spite of your situation.
And that's interesting how you have actual term for high functioning depression. I think like I've had this for many years before because when I came to this country, I just worked and I felt guilty to even like take a break or even take a day off. And I've been working since I was 17 and it was like nonstop for me for many years before I actually took charge of my life and I started enjoying it, started traveling and actually having fun because before, you have your goals and you're trying to reach your goals and you just don't stop and just being hard on yourself. But then it's like you pay off the price by struggling with mental health.
Yeah, I'm glad that you said that, and thank you for being vulnerable. I'm an immigrant as well. When I came to this country, my parents were like, you got to get straight A's, you got to do this, you got to take advantage of opportunities. You don't slow down, if and a lot of people who have either their parents are immigrants or they're immigrants, they deal this with the same thing. They never want to be in a position where they don't have anything again. So they just work, work, work. They don't live. They don't enjoy life, and they don't ever complain, but something's going to eventually happen. Either they break down and burn out, or they, use substances, or they, try to cope in ways that are unhappy. Um, like being addicted to relationships, things like that, soothing in ways that are not healthy, or even their bodies break down. Like I've seen so many cases where it's like people go to the ER and they're like, their heart is like beating out of their chest, so they physically faint. And then you ask them, is everything okay emotionally? And they're like, yeah, I'm fine, because they don't really process their emotions, but their body is like screaming for help. So eventually something's going to happen, right? And I want people to identify this before their body breaks down, before they mentally break down, before they get to a point where they're using substances or other unhealthy ways of coping.
That's true because our body is like the first signal if something is going on, something is wrong. It's like our body giving the signals like anxiety, panic attacks, and all that.
Yeah, absolutely. We don't listen to our bodies. Those of us with high functioning depression, we tend to carry a lot of tension in our shoulders, our lower back. Lower back pain is so common. And, instead of actually realizing that they're holding a lot of their trauma and their pain inside, they're going to doctors and popping pain pills and trying to pain pills, to kill the pain, but they're not realizing that actually this is something that's happening because they're constantly busy. And in my research, I find that people with high functioning depression, they're running from something, right? Rather than sitting still, because when they sit still, something feels off. They feel empty, they feel restless, they feel off, right? They just say, well, I don't want to sit still. I'm just going to keep busying. So on weekends, they're not relaxing. What they're doing is they're finding something else to work on. They're cleaning up or they're running errands. They don't ever recoup, right? And so it's important to realize that busying yourself and not slowing down is a way that people run from trauma, right? It's a way to avoid trauma. It's a way to avoid pain. And what you described, a lot of times when we come to this country, not having much or like never wanting to be in a position of being in with a lack of resources, that's something called scarcity trauma that many people experience. And even if you're not an immigrant, like let's say you have like a family history where maybe your family lost it all, or you went through a divorce and you lost things, or you went through bankruptcy, you may work, work, work because you never want to be in a position of scarcity again. So that's why you can't sit still. That's why you are pathologically productive.
And sitting still is scary sometimes because then you trap these all the thoughts and like you have to face your fears and you have to face your problems. So that's why people try to make themselves busy, not to cope with it, not to think about it.
Yeah, and that's why many of us we busy ourselves with our kids, right? Rather than us
Mhm.
having a life and us having a hobby, we're like, well, I'm just gonna focus on my kids, like, and then we obsess about our kids' activities. We're like overcommitting our kids and like putting them in soccer, putting them in piano, putting them in, and it's like the kid is now like depressed because they're so busy, right? Or like we focus heavily on like our partners, and we're like, our partner has an issue. We like want to fix our partner. We want to do all these things. It's like before you start fixing other people and focusing on them, focus on yourself. If you can't sit still, if you can't like just be okay with that empty feeling and work through it, then that says something. That's information that you're running from something, right?
Absolutely. And personally, how did you struggle? Did you have any challenges as far as like mental health?
Yeah, I mean, when I was in 2020, when I realized that I was dealing with this personally, it snuck up on me. I was surprised. I remember because I was at a desk and I was like giving a talk, this very desk that I'm talking to you right now, and I was giving a talk to this large hospital system. And, they didn't know what was going to happen in the world. There's April 2020, they were like, oh my gosh, like, are we going to die? What's going to happen? Can we go home to our kids? Is this safe? And I was there trying to give them skills and tools, but I realized, wait a second, I think I'm depressed. Like I'm hearing all these sad stories over my Zoom, and I'm like here struggling with my own depression, and I'm supposed to be healing these people. So I thought, like, I wonder how many people are like me, where on the outside you're like you're still functioning, you have a small kid at home, you have a partner, you're like taking care of a lab, you're doing all these things, but you're actually feeling very empty, numb, and also sad at times, right? Like I just wondered how many people were going through this. So I started doing the research and looking at it. And at the time, I still teach at NYU. I teach doctors how to give press interviews. Like, so like, when doctors had to go on TV and talk about COVID in a way that's not scary, I coach doctors to do those things. But at the time, they were saying a lot of people are getting information through socials. So can you teach us how to use socials? So in order to teach the doctors it, I had to learn how to use social media. And then I started putting out videos on high functioning depression and like it blew up. Like 20 million people around the world saw it and they were writing in like, how do you know this is me? Like, how do I heal? What do I do? So by me sharing something that I see and I experience every day, it allowed others to identify what they were experiencing. And then the next step was writing this book based on my research because I then went on to conduct the first ever clinical research study in high functioning depression. And my book is really based on the principles of people who have high functioning depression. They're running from trauma, so they have unprocessed trauma. They deal with anhedonia, which is the lack of interest and pleasure. And they tend to people please, right? These are the three things that we see. And then I also put in their tips for how to heal.
Tell us more about your book. So it's coming out April 8th, and tell us more. What inspired you to write it?
I really wanted to make tips and tools available to everyone because in some parts of this country, there's only like one psychiatrist for every 30,000 people. So I wanted to make sure that everyone had access to this information, right? To understand why is it that I'm this way? What are my unprocessed traumas? Some of the traumas that I put into my trauma inventory have to do with things that people don't talk about that are not usually on trauma inventories. Like, did you come to this country with very little? Were you bullied or were you rejected because of your culture or because of the who you love or how you identify? Did you ever have a position of like bankruptcy? Did you ever have a toxic boss? Like these are all things that are in there that people don't necessarily process. They're just like, oh, well, everyone has problems. But the problem with taking that approach is that if you don't identify the pain and process the pain, then you end up pushing it down. And when you push down the pain, you also may push down the joy. So you become numb and mute to everything because your whole coping mechanism is pushing down emotions, right? So I put in ways in there for people to identify traumas that maybe they don't necessarily identify. And also tools in there to help you identify what are the areas of life that you are lacking joy. Where do you have anhedonia in your life, so that you can try and pinpoint that and work on those areas. Because our temptation is to run from our problems, right? We want to focus on everything else but ourselves. But if you can identify the areas where you're lacking joy, then you can start to heal.
But what is the main reason? I mean, what are the best ways to cope with high functioning depression?
I always say that like as human beings, we were built with the DNA for joy. And we know this. We're born with the capacity to have a chemical in our brain called dopamine. That's a joy chemical. And so when I talk about the ways to heal, I say that joy is within your hand. It's within reach, but many of us forgot how to access it. So when you think of joy, excuse me. So when you think of joy, think of the 5 V's. The first V is validation. So acknowledge and accept how you feel. And this can be very challenging and difficult for people who don't process their pain. They just push through. They don't really accept the positive or the negative emotions. They don't take that time to reflect. So I want people to start practicing ways to accept and acknowledge their experiences. And this is important because when bad things happen to you and you don't process it, the human brain does this weird thing where it internalizes the blame. It says, well, you must have done something to deserve it, right? And you think about the way society approaches when bad things happen, we tend to be like, well, why was that person in that place at that time? We tend to blame the individual. But acknowledging and accepting how you feel allows you to separate yourself from the situation and say, oh, bad things happen to good people all the time. Maybe it wasn't my fault. So I deserve to heal. I am worthy, right? The second V is venting. So that's expressing your emotions. And venting could be talking about it, but not everyone has someone to talk to, or not everyone feels comfortable talking. It could be the way you were raised or your culture, or maybe you're neurodivergent. But venting can also just be expressing by writing, so journaling. It could be crying. like letting the tears out. It could be singing, it could be praying. Like there are many ways to express. It could be art, dressing certain ways. But getting those emotions out is very healthy. And then the third is values. So these are the things that are priceless, not things with price tags, and don't get me wrong, I like my nice things too. But at the end of the day, when I'm on my final hours on this earth, I'm not going to say, well, I wish I'd gotten that pink purse, right? I'm going to be like, I wish I'd spent more time in nature. I wish I had spent more time looking at that beautiful sunset, or I wish I had spent more time with my loved ones or doing causes that made me feel, purposeful, right? So those are the values that you want to tap into every day. And then the fourth is vitals. We only get one body and brain, so we have to take care of it. And like, if you think about it, there's only ever going to be one you. There's only going to ever be one me. So we're here for a reason. So we should take care of our bodies and not feel guilty when we're resting, not feel guilty when we're spending a little more to eat healthy foods, not feel guilty when we're carving out time to move our bodies, right? Not feel guilty when we're saying no to that toxic person who wants to steal our joy. These are all the vitals that make sure that our body and brain are healthy. And spending time away from technology and from work is really important. Those are in vitals. And then the fifth is vision, planning joy. So many of us, we get something done, we're on to the next, but take time to celebrate your wins and plan joy so that you have something to look forward to so you don't get stuck in the past. And these are five things that you can tap into. It could be one thing, one or two every day. I don't suggest doing all five every day because that's overwhelming. But if you tap into those things slowly every day, you're increasing your points of joy. And the reason I say points of joy is because in the real world, people want to be happy, right? So happiness is an idea. It's an ideal, if you will. Like, like when I get this, I'll be happy. But joy is an experience, right? So if I do something every day, I'll be happier. You're getting little points every day. So maybe today was a busy day for me, so maybe I didn't rest as much today. But tomorrow is not as busy, so I'm going to get more rest tomorrow. That's a point that I can get, right? Today was busy. I didn't drink as much water as I wanted to today, but tomorrow is a day that I can do it. Or maybe I can drink some water after this conversation, right? So like there are things that you can do every day to be happier, to increase your points of joy. So it's a mind shift, right? Rather than being happy, this idea, let's increase the amount of joy today, which is the experience.
That's a very interesting point. I love that. And as you know, I came here when I was 17 and it was so different for me. I did not face any mental health kind of issues till I was like in my late 20s because I was born in Ukraine and there is no term such a term as a depression, especially growing up. I never knew this term. No one ever was depressed around me. And coming to US, it's like so concentrated here, especially like people treat depression differently. They actually use medicine to treat it. They actually kind of pay attention to mental health. They talk about this. They actually have a therapist. And back in the day, it's like you don't have a therapist, you just talk to your friend. But the friends are sometimes going through a lot too, so they can't even help you. But it
Yeah.
was so different for me to actually understand and realize that there is help if you need it, there is therapist, there is also medication that can help you, but of course, it's like a last resort to use medication because you try to do it without it as much as possible. But here in US, it's like sometimes it's strongly encouraged. And that was like weird for me. How come you can't do it without medication? Why are they influencing you to get it?
Yeah, I mean, if you think about it, if medicines were like that effective, then everyone would be on it. No one would ever be depressed, right? But it's not that way. We're all complicated. And so in my book, I talk about the biopsychosocial model where biologically, medication is one avenue, but not everyone is, that's the best way to go about it. But there are other things biologically you can do. You can take care of your medical issues. Many of us have like autoimmune issues that are not well controlled or even recognized. So take decreasing that inflammation in our body that way. And then biologically, some of us have like high blood pressure or high cholesterol. These are all ways to actually improve your mental health. So, but we don't think about that. A lot of us treat the mind as if it's separate from the body, but the mind is connected to the body, right? And so when you think about it that way, you can address things differently. And then psychologically, we all have our own traumas, we all have our own histories. We have to think about that. We have our own attachment styles, ways we cope. And then socially, we're in different locations. Some of us live in cities, some of us live in countries, some of us are rural, some of us are urban. But also that means that some of us don't get sunlight, some of us don't have access to fresh food, or some of us, don't have access to community because we're in such a rural area, we're isolated. So thinking about ourselves in that way, the biological, the psychological, and the social way, using the tools in the book actually allows you to have multiple avenues to becoming happier. It's not just one way. It's not just the pill, right? Biologically, there are other avenues to increase points every day. And that gives people hope because a lot of times I have people who say, well, I tried therapy and I tried this medicine and I tried, but nothing worked. But it's like, but you only looked at one or two ways to getting happier. There are so many different ways that you can go about it. And that's why understand the science of your happiness is so different and so special because your science of happiness is going to be different than mine, right? And then that gives people more hope that, oh, I haven't tried and everything, that there's hope for me. There are different ways to becoming happier.
I love that. And also in your book, you highlight that some groups are more uh, influenced by, are more kind of, oh, sorry. In your book,
That's
you
okay.
highlighted that some groups, some demographics are tended more to get more high functioning depression than others. What's the difference?
Yeah, like if you think about it, people in healthcare, they're taught to like, don't think about their needs. How many times in medical school I saw surgeons like not taking a break to go to the bathroom or just not eating, and they just work straight through the day because they're taught the patient comes first, right? And then like teachers, if you think about, you know, they're constantly caring for students, going in their own purse to pay for their students, like supplies and so forth, staying behind at the school to help their students and so forth. And, think about like mothers. Mothers are often sacrificing their own happiness for their children and for their families. And it's not to say that that's not a good thing, but, it's something that I think is too praised, being a martyr, being a self-sacrificer. And unfortunately, women in particular are more likely to have this because women are twice as likely to have depression and anxiety than men, right? And so we're more likely to have high functioning depression. We're often told to just like be a good girl, be a good wife, be a good mom, right? The standards are so much higher for a woman. And that's social pressure, right? I talked about the biopsychosocial, but then biologically, we're more at risk because of our hormones, right? Like we go through periods of vulnerability because of our hormones. Like we go through our periods when we're in puberty, and that makes us more prone to having, these depressive symptoms. And then when we give birth, if we give birth, postpartum depression, and then as we go through perimenopause in our 30s and 40s, and then menopause in our 50s and on and beyond, the hormones make us more likely to be vulnerable. So women have that biological factor and then the social pressures. And then psychologically, we have more of a history of trauma. We're more likely to be survivors of sexual assault. And, we tend to get more bullying in the workplace too. So that trauma is there. And, we have to think about how difficult it is for women these days and to honor that and acknowledge it and give women more support.
Yeah, so true when we think about it, actually is. And because even like monthly, we have to go through a lot emotionally too. Like with a period, you go through different stages of your mood. And even like some women, premenopause, post like menopause, and like you mentioned, giving birth and after it's just sometimes you can't even explain, but it's your emotions, it's your hormones make you crazy sometimes, and it just affects your mood in some ways. So not
Yeah, I mean, it's really interesting because like whenever you go into the maternity section, it's like flowers and bright and all this stuff. But 80% of women experience the postpartum blues. So I feel like it's like a gaslighting. Like we're told to be happy, but our biology says you're not supposed to be happy. 80% of us are supposed to be sad and weepy. So it's like it's kind of like it for me, it almost feels like you're going to a funeral and you're like dancing, like, hey, everybody, let's dance, right? Like it feels a little bit disrespectful. So I think there needs to be a shift. Like, yes, it's happy to have a baby, But there should also be two things can be true. You can say, wow, congratulations, this is wonderful, you're a bundle of joy, but also let's take care of you because right now you're super vulnerable. You know, your body just went through hell and back. Like we're stretched like this, and then we're like it's like this such a like this violent thing, you know, because it's like out of our body, and then we're like we have all these medical issues afterwards and mental health issues, and then we're told, let's party, let's celebrate. It's like very unfair. So I think we do need to rebrand when it comes to birth, right? Like it's like, yeah, let's celebrate the baby. At the same time, let's honor the fact that you as the mom just went through something crazy, right? Like let's add it to your medical history, like under high blood pressure and under like, I don't know, high cholesterol, there should be pregnancy number one, pregnancy number two, pregnancy number three, because it's like literally a traumatic event on your body and your brain. So I do think we need to acknowledge that. The same for periods. Like, it's like, oh, everyone goes through their period. That doesn't mean that it's not painful. That doesn't mean that it's not problematic, right? Like the things that we as women go through in order to reproduce, it's just very unfair how we're told that, well, all women go through it, so you should be fine. Like two things can't be true. All women go through it, but also it sucks.
Yeah, absolutely. I couldn't agree more. Huh. And as we talk about women's health, how does like hormones in premenopause, postmenopause, menopause actually affect women's bodies and why they're at such a high risk of getting high, depression?
Yeah, so when you think about your ovaries, when they produce hormones, those hormones travel throughout the blood, and the blood take goes to the brain in higher volumes than any other part of the body. So when you're not getting those hormones or you're getting intense fluctuations of hormones, then, the brain was accustomed to having, a certain amount of hormones in the brain, and now it's like either very high or too low or erratic, right? So you should experience some type of mental health symptom related to the hormonal fluctuations and the changes that happen with perimenopause and menopause. And what people tend to experience is something I call TIES, TIES. The T is thinking issues. So that's like you can't remember as much, you can't multitask as much, you're forgetful. The I is identity issues, like not feeling like yourself anymore, feeling like, oh, I don't like how my body looks anymore. Like, I don't like that I have this tummy fat. I don't like that I have to pee so frequently. I don't like that sex is painful. I don't like that, like, my hair is thinning and my skin is thinning. Like, so you start to question who you are, your identity changes. And also because you feel different, you feel like you don't know who you are anymore. The E is the emotions, the feelings. People tend to have symptoms of depression, anxiety. So that's sadness, anxiety, weepiness, irritability. And then the S is sleep. So usually that's the first symptom that I notice is that people used to get deep sleep and now they're having a hard time falling asleep and staying asleep, or they don't feel as rested, right? And so when you recognize that these are the things that happen in perimenopause and menopause related to hormones and how it impacts your brain, then you can start modifying your life around it. So, for your thinking, you're probably not going to over book, right? You're not going to overwhelm yourself and overextend yourself. You're going to focus on the things that really matter so that you give your mental energy in places where it means the most, right? You may want to declutter your home so it's easier to find things. And then with the I, the identity issues, you may want to start spending time with people who are supportive, who can reassure you as to who you are, engage in things that really bring yourself a sense of purpose. And so if those things are things that you feel like you can't do as well anymore, you may want to consider like shifting, right? Like if you're someone who used to be more active and hike, but now your body's changing and it's harder to do those things because of osteoporosis and all that stuff, it doesn't mean that you're no longer active. You just may have to modify what you're doing, right? And get support there. If your body feels different because, your skin is changing and, you don't feel as attractive anymore, then you may want to get different products so that you get support, like work with a dermatologist. All of this is important. It's not vanity. Like I take very serious care of my skin. My skin has been a priority since I was in my 20s, right? Because it means so much to me to have nice skin that I love it to look at, right? Not necessarily for others. And I don't consider it vanity. I take care of my hair. I research hair products because it makes me feel good, right? And so like, don't feel guilty about doing that. You may have to spend a little bit more time in that area as you get older because it's more challenging, right? If, again, with identity, if you're not enjoying sex as much, like, don't ignore that. You're not being like, unreasonable. You should demand better sex, right? So like, look into working with someone who's a pelvic floor specialist, a pelvic occupational therapist, using products to help you with, the lubrication down there, HRT if you have to, right? So like there are things that you can do. Um, the ease the emotions. So like if you're feeling sad or depressed or irritable, anxious, you may want to work with a therapist because a lot of therapists do work with cognitive behavioral therapy, metacognition, dialectical behavioral therapy, even meditation to help you feel it more in control. Because if you don't address this, what you end up doing is saying like, oh, I'm a bad person because I snapped at him, or I lost my cool in the meeting. They're gonna think I'm unprofessional. Maybe I shouldn't work anymore. And we need women in the workplace. Women are effective leaders. We're really good at what we do, but we need support when we go through midlife. So, and some women will need antidepressants and mood stabilizers and anti-anxiety meds, and that's okay too. Everyone's different, right? We have to understand the science of our own happiness. And then the S is sleep. So things that are important for sleep is, like making sure that you're not having too much caffeine, making sure that you're like unloading your stress before you go to bed, doing proper sleep hygiene, like keeping the room cool, keeping the room dark, not having your phone next to you, taking off, all those lights after 9 p.m. Like if you're having hot flashes at night, making sure you have like some cold water near you. Some people keep a fridge near you. And doing things that help your body to regulate temperature, like getting good nutrition, not eating foods that are processed because the inflammation worsens your menopause symptoms. Lifting weights instead of, being on the treadmill because we need to increase that body muscle because that helps us with our metabolic issues, right? And so you think like, what does that have to do with sleep? Well, like metabolic issues interrupt good sleep. A lot of women start to get something called obstructive sleep apnea as they get older. So because the body fat distribution changes as you age. And so, making sure that you're getting good muscle and you're building muscle, eating protein, eating fiber, lifting weights, that all helps. And, but no one tells us this. And that's why knowing this information is so powerful because then you can have the best outcome.
And these are incredible tips. And like you mentioned, if we use them, it definitely makes everything easier because not many people know what they should do and they don't recognize symptoms, so they don't know how to cope with it.
Yeah, they don't know. And a lot of doctors only get one class in menopause. So it's really, again, women's health gets neglected, right? We have to end up learning it and advocating for ourselves. And now that we know that, then we can help other women, right? That's when you start talking about it, you start sharing. You realize that you're not alone, that this is not just you. There's nothing you did wrong. This is part of your biology and biopsychosocial. It's a part of your happiness. So learn about it because you deserve it. There's only one you. There will only ever be one you. So you deserve to understand the science of your happiness.
It's so true. And what advice can you give to women how to recognize high functioning depression and what should be the first step?
The first step is I want you to say to yourself, I am a human being, not a human doing. If you find yourself busying yourself, you're always doing, doing, doing. Why is that? Maybe you're running from something, maybe you're in a bad relationship and you just don't want to be around the person. So you busy yourself so you're not home. Like you'd be surprised at how many times I see that with clients. Why am I so busy? Why can't I relax? Because you're always running. You're running from the person at home that's making your life a living hell, right? And so I want you to practice, being a bit more still and present. That's the first step. And then you can practice those 5 V's.
Well, that's amazing. Thank you so much, Dr. Judith. And where can our listeners find you, where they can purchase your book?
Well, thank you for having me. You can find me at drjudithjoseph.com, and you can take my anhedonia rating scales to see where you are on that. You can take my trauma scales, my ties for menopause scale, my high functioning depression scale, and learn about your science because you are so important. There's only one you. You deserve to understand what's happening with you. And you can follow me on all the socials at Dr. Judith Joseph as well. And my book, High Functioning, comes out April 8th, and it'll be sold wherever books are sold. But when you pre-order it, you get tons of bonuses. So it's worth it to pre-order even before the pub date.
Thank you so much, and thank you for being my guest.
Thank you for having me. It was a wonderful conversation.
Thank you.